Welcome, everybody. It's my honor and privilege today to introduce a dear friend, Dr. Yvonne Kason. She's going to speak this afternoon. She's a family physician, a transpersonal MD psychotherapist, author of several books, including Soul Lessons from the Light, Touched by the Light, and she's responsible for coining the phrase spiritually transformative experiences, or STEs. She's president and co-founder of Spiritual Awakenings International. And please join me in welcoming Dr. Yvonne Kason, who is going to talk about the newest near-death experience discoveries. Yvonne?
Thank you, Robert. It is my great pleasure to speak with everyone today. And I'm delighted to see so many of my friends from around the world in the audience. Thank you, all of you, for coming to hear what I have to say. My topic today is newest near-death experience discoveries. So as many of you know, you'll find what I'm talking about today in my book, Touched by the Light. But many people ask me, as a traditionally trained Western medical doctor, how is it that I got interested in things like near-death experiences and spiritually transformative experiences? STEs is short for spiritually transformative experiences. Well, it happened because of my own personal spiritual awakening experiences. When I was in medical school at the young age of 23, I was meditating, and one day I had this really powerful experience that I didn't even have a word for many years. All of a sudden, I heard this loud inner roaring noise, like the roar of a waterfalls, and I felt this really powerful energy move up my body and up my spine and up through the top of my head, and I expanded, and I was above my body, and I went into this incredible state of love. I now know many, many years later that this was a Kundalini awakening with a mystical experience, but I had no idea what this was. And I was in medical school, so I just sort of put it beside in the back burner, didn't focus on it. But I had another experience a few years later when I was a young doctor that made me realize something unusual is happening to me. So when I was 26, when I was a young doctor, I was involved in a medevac plane crash. I was in a small medical evacuation plane. It was like this. It was a small twin propeller plane. It was the middle of winter in northern Canada. We flew into bad weather. The plane crashed onto the surface of a semi-frozen lake, then sank, and I had to swim a long distance to shore. Now, what is interesting about my near-death experience is that it started before the plane crashed. That actually, when my experience started, was as the plane was going down. We lost one engine, then we lost the other engine. It was a twin propeller plane, and the plane's going down in really bad turbulence. And immediately it jumped out of my heart. Oh God, help! I'm gonna die. And it seems like that was close enough to a prayer, because that's actually when my near-death experience started, while the plane was going down, before it crashed. And what happened was, all of a sudden, this feeling of beautiful peace descended upon me, and it pushed down all of my fear. And I felt completely calm, completely unafraid. And I heard a strong inner voice say, "Be still and know that I am God. I am with you now and always." And with those words, the vibration of peace, safety, the presence was so strong. I remained in that state of peace till the plane crashed. He managed to get it onto the belly of a semi-frozen lake, his belly landing, and then it nosedived and sunk. And I had to swim a long distance to shore in winter in Canada in heavy winter clothes. And as I was swimming to shore, struggling to swim to shore, is when my what I now know is a near-death experience deepened. And all of a sudden, I heard a loud roaring noise, again, like what I heard with my Kundalini awakening. And all of a sudden, I rose up out of my body, and my consciousness was above my body. But it was different than leaving my body, because actually my awareness was two places at the same time. I compare it to the split screen TV, which we're all experiencing now. The little image, a little part of my consciousness was still in my body that was desperately struggling to swim to shore. But the big picture, most of my consciousness left my body, rose up, and went into this beautiful white light realm. And so most of my consciousness entered this place or state of consciousness. Is hard to know what to call it, but I was feeling incredible, powerful, beautiful, unconditional love. And the place was filled with light, like the top of the sparkling tops of the clouds as a plane is ascending the sparkling tops of the clouds. That's what it was like. Beautiful, soft white light. But the love was so profound. And it's like my soul recognized what it was that I was feeling. Somehow my soul knew that what I was experiencing was the love of the higher power, or what I had been raised to call God. And I was not at all experiencing it like my religion of childhood had taught me. It was not an old man with a long white beard sitting on a throne judging me, but it was like this universal force field of love, of infinite intelligence that's penetrating, underlying all of creation, all of non-creation, past, present, and future. And I remained in this expanded state above my physical body until my physical body managed to swim to shore. We were rescued by a miraculous series of coincidences. I write about it in my books, brought to the closest hospital, which was in Kenora, Ontario. And they revived me. They resuscitated me because I was near drowning and near frozen at that time, hypothermic. They revived me by putting me in the hot whirlpool baths to reheat my body. And then suddenly, while I was being reheated, I felt whoosh, how they depict on movies a genie being sucked into a bottle. That's how it felt. My consciousness had been at this big place up there, and suddenly I was sucked into the small confines of my body, and I was back. But this plane crash experience, I mean, I now know it was a near-death experience, but for years I didn't even have a name to call this experience. But it had tremendous after effects on me. I mean, first off, which was sort of a puzzle to me at the time and for many years, it created a marked increase in my Kundalini sensations. What I now realize were Kundalini sensations, recurrent rushes of energy up my spine, recurrent inner sounds. My spiritual focus dramatically increased after this, what I now know is a near-death experience. I completely lost my fear of death because I knew that all of us live on after we die, not just me, all of us. But also, I had a tremendous psychic awakening afterwards. I started having all the clairs, clairvoyance, clairaudience, clairsentience. So as a young medical doctor, I wanted to know what this was. What is this that's happening to me? There are changes happening in my consciousness. And I struggled for years to even try and find names to call these experiences. I mean, now, yes, I know it was a near-death experience, and before that, a Kundalini awakening. But it took me years until I was able to find those accurate names. I was convinced they were not hallucinations. I knew there was something powerful and spiritual that were continuing to impact my life in a positive way. So for many years, I was in the closet. I was secretly researching spiritual experiences, secretly meditating, being a spiritual seeker, and on the outside, being a traditional Western medical doctor. But that all changed in 1990 when I met Dr. Kenneth Ring, and he looked very much like he does in this photo in 1990, very jovial, friendly, uh, kind individual. He's one of the founders of IANS, the International Association for Near-Death Studies. I met him at Dr. Bonnie Greenwell's house, believe it or not, in 1990. And I talked to him about what I experienced in the plane crash. And I said, I've been told it's not an NDE because A, it started before the plane crashed, and B, I was never dead, and C, I never saw a tunnel. And he burst out laughing, sort of like this picture here. And he confirmed, he says, don't worry, Yvonne, what you had, yes, that was a near-death experience. And he said, but you are what we call an outlier on the NDE bell curve. And I thought, what? What is an outlier on the NDE bell curve? Well, this is one of the things I'm going to be talking about today on Newest Near-Death Experience Discoveries is what it is to be an outlier on the NDE bell curve. And this is a bell curve for those of you who've studied mathematics and statistics, etc. And most sort of the commonest and what they range as average or normal or usual is what's in this purple zone in the middle. So most people who have a near-death experience, it's around the time of their accident, and these are the sort of symptoms and experiences they have. Then there are ones that are in the green zone that are a little bit less common, but they're still in the range of normal. Then you have the ones that are in the yellow zone, and these are called the outliers at either end. And so mine was an outlier in that it started before the plane crashed, and that my consciousness was two places at the same time. That's all within the spectrum of near-death experiences, but it is an outlier on the NDE bell curve. Well, with that reassurance that I was an outlier on the NDE bell curve, that gave me the courage to come out of the closet. And in 1990, after speaking with Ken Ring, I specialized my medical practice in the counseling and research of people with spiritually transformative experiences. Actually, a few years later, I coined that term, and then I started writing books. Those are my first two books I wrote on spiritually transformative experiences. And this is my most recent book that I wrote on the spectrum of spiritually transformative experiences. And I divide spiritually transformative experiences into 6 main categories. And I use the yogic model to begin with the whole clusters of types of mystical experiences, which in yoga are well described as different kinds of samadhis. And then there are many, many types of psychic experiences. That's the second type, or intuitive experiences, that are another type of STEs. This would be called siddhis in yoga. Then we have the spiritual energy awakenings, or kundalini awakenings, which we've heard a lot about today. A fourth grouping is inspired creativity and genius. A fifth category, which is going to be the focus of today's talk, is near-death experiences. And then there's a sixth grouping that I gave, which is other death-related STEs, like end-of-life experiences and after-death communications. So much to my surprise, the good Lord has given me 5 near-death experiences over the course of my lifetime. And each of my near-death experiences were different. And these pictures sort of show you some of the key differences. My first one, the bottom left-hand corner, that's me at about the age of 7. But my first near-death experience happened at the age of 5 and was different from all my other ones. It was more like a time stood still near-death experience, although I went out of body. The next one, the man floating over his body above lying in the bed, that was my next childhood near-death experience that happened at the age of 11, when I had clear recall of being floating above in the hospital room, looking down, watching the doctors try to resuscitate my body after I'd been in a serious car accident. I was in a coma for 3 days. The middle one is, of course, my plane crash near-death experience that I just told you, where I went out of body while I was still swimming to shore in my body, my consciousness 2 places at the same time. The upper right-hand corner was my 4th near-death experience in 1995, where I experienced going up a dark blue tunnel-like space towards the light. And then the bottom right-hand corner is my most recent near-death experience in 2003, where I saw beings of light. So this is not only have I had 5 near-death experiences over the course of my lifetime, but they were all a bit different from each other. So I'm going to tell you now a little bit about my most recent one, which was in 2003, because that was what I call my near-death experience, because that was the only one of my near-death experiences where I was actually clinically dead for a period of time. I had a slip and fall accident at Niagara Falls. I slipped on black ice. I hit my head on rocks, and I instantly died from a brain hemorrhage and serious traumatic brain injury. And immediately a force greater than myself whisked me out of my body, and I found myself going up through this dark, dark, expansive space towards the white light. And when I arrived in the white light realm, I was welcomed by two saints in their light bodies, in their luminous, radiant life bodies, light bodies. And I immediately recognized them. Immediately. It was Paramahansa Yogananda and Mahavatar Babaji in their light bodies. And they were welcoming me, and there was telepathic communication. And what they telepathically communicated to me was that my physical body had died, that my work in the incarnation as Dr. Yvonne Kason was now completed, and there was a feeling of joy, of celebration, like a graduation party. Congratulations, you graduated from this class in school. And I felt that incredible love of the higher power. And there's much that happened on the other side. I had a long experience, but I don't want to go into too much detail today because I want to get to the subject of our talk, newest near-death experience discoveries. But I remembered all of my past lives. I went into this really, really expansive state of consciousness. And I sometimes say it was like my brain got upgraded from a Pentium 5 to a Pentium 1000. And I was capable of assimilating, understanding, and integrating a vast amount of information all at once. And I remembered all my past lives. It made complete sense. I finally knew who I was. It was an incredibly healing experience. And then at the end of what felt like timeless time on the other side, because time was experienced completely different on the other side, I was given the choice by the beings of light whether to return to my disabled body. And when told that it was the higher choice, although it would be more difficult, my heart immediately responded, I accept. And with a flash like that, I was suddenly back in my body, but with a serious traumatic brain injury. And this traumatic brain injury disabled me. I was disabled due to the multiple levels of problems I had from the traumatic brain injury for 12 years. I had huge worldly struggles, took all my energy to deal with what I had to deal with from healing from traumatic brain injury. I could no longer be active in the world. And so I had accepted that from that point forward, my outer worldly life was over. But just when you figure you know God's plan, God has a surprise for you. Because 2016, February 24th, 2016, I experienced a miracle, a brain healing STE. It happened in the Self-Realization Fellowship Retreat in the Meditation Chapel in Encinitas, California, which is a place where Paramahansa Yogananda used to meditate and go into samadhi. So it's a power spot that's filled with his vibration. And being clairsentient, I like to meditate in power spots. Anyway, as I was meditating there that day, suddenly I experienced a burst of light in the center of my brain, and it felt like waking up. It felt like after my brain being asleep, or a part of my brain being asleep for 12 years, suddenly woke up and my brain was healed. And I was given the strong inner message, pass on what you have learned. And so that, my friends, is what I'm doing today. Now, today, I'm going to be sharing with you what I've learned are some of the newest near-death experience discoveries. Now, first off, what is a near-death experience? So most of you would know this was a term coined by Dr. Raymond Moody back in 1975. I had the great honor and privilege of interviewing him last year at our Spiritual Awakenings International Conference. And Dr. Moody, when he coined this term, he said that a near-death experience was a profound experience with distinctive features. I'll go into the features in a second, but that it occurs to a person when they are clinically dead. And then later, when they're resuscitated, they tell us about it. Or it can happen to a person when they're close to death. Now, what are the features of a near-death experience per Raymond Moody? And these features, they're all accurate. So I'm just saying this is the base work that we're going to build upon today, because all of the features that Raymond Moody said, they are still accurate to this day. We just know more now on top of this. So the features of a near-death experience that's ineffable beyond words, meaning it's a lived experience. The feeling component is so strong that you can't really put into words the feeling component of a near-death experience. There's auditory awareness, meaning that you can hear what's being said around your dead or unconscious body. There's strong feelings of peace. Pain goes away. People may have unusual inner sounds, like I heard the roaring of the waterfall sounds, going out of body. Some people experience traveling up a dark space or tunnel to the light. Some people experience meeting departed spirits, maybe loved ones, maybe archetypes from their faith. Then entering the white light realm, the heavenly realm of love. They may or may not have a life review. They may sometimes have a life barrier or a choice whether or not to come back to the body. When they do return, it's an abrupt return, that afterwards people are they have conviction of the reality, even though people say they hallucinated it. NDEers go, no, I did not. I remember it clearly. It was real. There's a transformational impact on the individual. They lose their fear of death, and there is independent corroboration of what was observed outside the body while they were out of the body. So those are the classic features which are still true to this day. And we now know, and even Dr. Moody wrote about this, that NDEs have been reported for centuries. And here's a picture from the 1500s of it looks like angels helping people go up this tunnel to the light. So we now know it's been reported for centuries. So what are some of our newest near-death experience discoveries? Well, first off, we now know, which is new, that near-death experiences are one subtype of spiritually transformative experiences. So it's under the umbrella of spiritually transformative experiences. And also the definition has now expanded that I define it as an out-of-body and or white light or mystical experience. That is, it's an STE. It's an STE, and it's the timing of the STE. It's an STE that happens when a person is close to death, or while they're clinically dead, and they tell us about it after they're resuscitated. Or now what's new is that we discover people have near-death experiences when they're facing imminent death or facing imminent trauma. Just like mine, when the plane was going down, I was fine. Nothing had happened to me yet, but I was facing imminent death. So this is the new definition that I use, which is expanded. What I now also define near-death experiences into 3 distinct subtypes. And the first near-death experience type is the out-of-body experience. Now, for many people who have near-death experiences, their entire experience is the out-of-body experience. And the transformational impact is different compared to those who go on to have a mystical type of near-death experience. So I separate the two because the after effects are somewhat different, but they're all near-death experiences. There's just a different type. And in the out-of-body experience, it's very, very common in the out-of-body NDE that the person finds themselves above their body looking down. However, that's not always the case. Sometimes people find themselves beside their body, behind the doctors who are working on them, at the foot of their bed, at the head of their bed. And sometimes people find themselves moving to other places in the hospital when they're out of body. Sometimes they're even moving to where loved ones are, either in the hospital or somewhere else in their home. So that the out-of-body experience can be various locations, but for some people, that is the entire near-death experience, is their out-of-body experience. But in the second subtype, which is the mystical or white light type of near-death experience, that might start, and it often starts with an out-of-body experience, but then the vocabulary is it becomes deeper. Then they move on into the mystical or white light experience. And people who have the mystical type of near-death experiences, I mean, when they go into the white light realm, they may get profound teachings, profound lessons. They might see the Akashic records. They might see departed spirits. They might feel they're in the presence of God. There's a wide spectrum, but it all falls under the umbrella of a type of mystical experience. And these are the most life transforming near death experiences are the mystical type of near death experience. But there's a third type of near-death experience we now realize, which is a distressing near-death experience. And when I write about it, I divide this into three subcategories of people who've told me their stories. And one type of distressing near-death experience is people who are actually fighting the NDE pull out of their body. So they were being pulled out of their body, and sometimes they even knew that they were being pulled towards the light, but they were fighting it. They were fighting it, and they've described it to me. It's like swimming against a really strong undertow. They were desperately trying not to get pulled out of their body. And so this is what caused their distress, was that they were so desperately fighting the pull out of their body. So this is one, in my experience, unique category. Many people have described that this was what was distressing, was the fight to not pull out of their body. They didn't want to die. And then there's a second type of distressing near-death experience we now know, which I call the low astral NDE. And so how I would explain this is, in yoga, it's understood that there are many levels in consciousness on the astral planes, many levels in the astral planes, that when our consciousness leaves our body, when we have an out-of-body experience, if we're blessed and lucky, we go to the highest astral planes, the heavenly realms, and we enter the white light. But some people stay on this level, which would be when they're out of body around the hospital. But some people might actually go to lower astral planes where they encounter dark entities or tormenting entities. And some people have reported near-death experiences that start as a low astral, frightening experience, but then maybe when they prayed, or maybe through the grace of the divine, they got lifted out of that. And some people started with a high experience and then they were shown the low astral. Some other people experience this. So there are many variations of this, but this is a distinct category. People who've had low astral experiences, what I call low astral experiences of dark or tormented souls in a distressing NDE. And then there's a third category, people have told me about distressing NDEs, which I call the nightmare-like distortions. They say it's like being hallucinogenic acid trip or something, where things are just not making sense. And I wonder if these distortions, etc., might be due to some toxins from, the illness or whatever they're having that are in their brain that might be causing the distortions. But this is, in my experience, three distinct types of distressing near-death experiences. We now have studies to look at the frequency of near-death experiences, and Dr. Pim van Lommel found with cardiac arrest patients. So these were people who were clinically dead for a period of time, like flatline, no brain waves, no heart waves, that 12% of them, so it's only 1 in 8, reported a near-death experience while they were clinically dead. However, we don't have studies for facing death NDEs. We really don't know what percentage of people have a near-death experience when they think they're going to die. Now, we're getting into some other interesting new discoveries about near-death experiences. And one is the NDE time paradoxes, because time can bend during near-death experiences, we are now discovering that many people have reported, and this was true for me in my most recent near-death experience in 2003, that my near-death experience was much longer than the time that seemed to pass on Earth. That it seemed like I had a long experience, that time somehow bent and brought me back into my body in a shorter time period than what had elapsed on the other side. And many people have reported this. But the opposite can also happen. Other NDEers say, and this happened to me actually when I was in the coma, 11 years old, my near-death experience. My near-death experience was much shorter. My memory of the near-death experience is much shorter than the time that passed on Earth. I was unconscious for 3 days, but my memory is maybe for an hour or so. So, but other people have reported this too, and I've heard that this is particularly common when people are in coma when they have their near-death experience, that the near-death experience can be much shorter than the time they were clinically dead or unconscious on Earth. Other NDE time paradoxes and time bending is that NDEs can stop time. And I said that that happened when my childhood near-death experience, where at 5 years old, where it felt like my life was a video and someone pressed the pause button and I'm out of body and I'm watching it. Oh, my life is on pause. I'm thinking, my thoughts are continuing to go, but the movie of my life seemed to have stopped. And then when someone pulled me out of the path of the oncoming train, so I wasn't hit, all of a sudden the pause button was released and the movie of my life started going forward. So other people have said that time seemed to stop in their near-death experience too. Another phenomenon of time bending is that NDEs can begin before the trigger event. So in my plane crash, yes, it began as I was facing death, but some people, it begins even before they know they're going to be facing death, that it might happen an hour before they start slipping into an expanded state of consciousness, or 2 hours before, or they start going out of body before the anesthesia is given. So various versions of the NDE starting before the trigger event. To me, it's like sort of time doesn't line up exactly between the other side is here. And then there are some remarkable occurrences where the NDE happens after the trigger event. And one of the stories that I think demonstrates this very, very incredibly clearly is Beverly Brodsky, who many of you may have known. She used to be the head of San Diego Ions. Bless her soul, she's departed now. But she had a really classic near-death experience that even Dr. Kenneth Ring included in his book. But it happened days after her motorcycle accident where she was almost killed. So it's not always lining up time-wise. And this is what I want to bring back, the NDE time chart for the outliers. These are the time outliers. So some people, and then the yellow part, their NDE is starting before they have their near-death incident. And then there are other people where their NDE is happening afterwards. And then there are those that it starts before and it continues afterwards. So there are many variations we are now discovering to the timing of near-death experiences related to when the actual near-death trigger was. Another thing we're discovering in the time paradoxes with near-death experiences is that time is not linear, and that on the other side, past, present, and future seem to coexist. And I experienced this in my 2003 near-death experience, because it seemed that depending on where I focused my attention, I could focus on what we here on Earth perceive as the past, or if I shifted, I could see what we here on Earth perceive as the present, or if I shifted another way in my consciousness, I could see possible futures. And other people have reported this in their near-death experiences, that it seems like past, present, and future are somehow coexisting or happening the same time when they're on the other side. And another factor that relates to this is that some NDEers have a life review where they re-experience things, even going back to their conception in this incarnation. But other people have life previews where they're given glimpses of important events or decisions that are going to be happening that, as we experience time here on Earth, haven't happened here yet. So past, present, and future seem to coexist, and we can get glimpses of the past or the future when we're in a near-death experience. Another new thing we're discovering about near-death experiences is what I call the memory paradoxes. So there's something really unusual about the way near-death experience memories are retained. There's like unusually clear memory of near-death experiences. Like you ask me, what did I have for breakfast in 2023? 2003, November 2003. I couldn't tell you, but my near-death experience in November 2003, I remember that very clearly. Even all 5 of my near-death experiences, I remember them clearly. And this is not something unique to me. Near-death experiencers report this, that there's something unusual about the memory of near-death experience. It's like it's etched, it's into the hard drive of our brain that we can remember it. And there's another unusual feature about near-death experiences is that when people start thinking about them or talking about them or remembering them, the experiencer begins to re-experience the feelings. So when I talk about my near-death experience and I think about the love and bliss that I had, I start feeling it. I mean, I'm feeling it right now, thinking about my last near-death experience. It brings back the feelings, which is another very unusual thing about memory of near-death experiences. Another point I want to make here is that sometimes near-death experiences may return in chunks. So, I think sometimes there's a misconception that either you remember it all at once or you don't. And maybe for some people that's true. But it's also true that sometimes the memory might come back in chunks. And this happened to me with my 2003 near-death experience. I remembered a lot of it right after I came back to my body. And in fact, I thought I had remembered all of it until it was at least a year later. I had what I call a soul retrieval experience when I went to a Native Indian sacred site, and all of a sudden, I remembered the beginning and the end of my near-death experience and realized that up until that point, I'd only been remembering the middle. And once the beginning, which was extremely painful when I hit my head, I guess I blocked that memory. When that memory came back to me clearly, although it was a very painful memory, it felt good. It felt, oh, okay, I'm more complete. My memory is now complete. I now remember how it started. I now remember the pain of when my head hit the rock and it was like an axe chopping into my brain. But remembering it now, it's like I feel more complete. I feel more whole. And similarly, initially, I had not remembered that I had been given the choice whether to come back. So when that chunk of memory came back to me, again, it felt like a piece of the jigsaw puzzle got put into place. And it was like, oh, I get it now. That sounds exactly like me. Given a hard assignment, my hand shoots up and I go, yes, I'll do that for God. So, and other people have described this to me as well, their memory coming back sometimes in chunks. And some people, they know they've had an experience, but they find they need to go for some reason, who knows why, to regression therapist or in a supportive environment before that memory will come out and they remember it again. But once the memory surfaces, even if it's come back in chunks a little while after the experience, it then becomes etched in memory. It then becomes like those first features, etched in memory and unusually clear recall and bringing back the feelings. We now know another one of the new paradoxes in near-death experiences is what I call the bilocation paradox. And that, as I described in my plane crash experience, consciousness can be two places at the same time. And I had one NDEer tell me she felt her consciousness was three places at the same time during her near-death experience. So from our worldly perspective, we think this is not possible, but from a consciousness perspective, it's happening. Another new thing we're discovering with near-death experiences is some of the physical paradoxes that happen, and I find this very fascinating. And a lot of them are what I call the car accident miracles. And I've had NDEers telling me that their NDE happened, they were about to T-bone a car, and then suddenly they're on the other side. There can be no explanation other than their car somehow drove through the other vehicle. And during that time that they're driving through the other vehicle, defying physics, is when they had their near-death experience. Other people have told me that it was as if their car jumped over the oncoming vehicle, and that they had their near-death experience while their car inexplicably seemed to be able to jump over the other vehicle in the accident. And another near-death experiencer told me that there she was, there was her head on, she starts going into her experience, and then suddenly, inexplicably, a force, some invisible force, moved that car, no scientific explanation, so that she was able to safely drive by. So many reports of physical paradoxes, and the ones that I'm telling you, they're all car accident miracles. That, how do you explain it? Another new thing we're now realizing about near-death experiences, I alluded to this earlier on, is that you don't need to be dead to have a near-death experience. I mean, I was told back in when I had my near-death experience when I was 26, that because I'd not been clinically dead, it was not a near-death experience. Well, Ken Ring told me untrue. So we now know that's not true. You don't have to be dead to have a near-death experience, although many of them do happen when people are dead, clinically dead. NDEs also can happen when you're facing imminent death, when you think you're going to die. And this has been reported from military on battlefields, people in near-miss car accidents, being shot at but missed. It can also happen if you're facing imminent trauma, facing some sort of horrific abuse, facing serious surgery, serious illness. It can happen during severe illness. When you have a high fever, very high fever, when you have a coma, when you're under anesthetic. So there are other situations you don't have to be dead to have a near-death experience. And we now know who has near-death experiences. Anyone. See, this wasn't known 40 years ago, but we know it now. Anyone all over the world. There are cases of near-death experiences being reported in countries everywhere around the world. And what we also know now that's new is that near-death experiences happen at all ages. There are people who recall that, sometimes under hypnosis, but recall having a near-death experience while they were still in the womb. And this was later confirmed by their mother that, yes, the cord was around their neck and they thought the baby was going to die, blah, blah, blah. That under hypnosis and sometimes in meditation, people remember a near-death experience happening while they were in the womb. It can also happen during birth. That is, during your own birth process. If you have a difficult childbirth, again, the cord around the neck, or lost a lot of blood, or you were a blue baby, that people then report that they have memories of having a near-death experience at birth. We know it can happen at any age in childhood. I mean, even at our conference here, we have people who had near-death experiences at 2 years old, at 3 years old, and I had one at 5, I had one at 11. We also know adults of all ages, through their 20s to their 80s and 90s, are having near-death experiences, and they will often happen shortly before death. Something else I want to mention here is that a non-NDE brush with death can also be transforming. Now, what I mean by a non-NDE brush with death, here you see somebody brushing their teeth with the Grim Reaper as a brush with death. That people will say, "Oh, I had a near-death experience. I was almost hit by a car and blah, blah, blah." And I'll say to them, "Oh, that's wonderful. Tell me what happened. Did you go out of body? Did you have a feeling of peace? Did you go up into the light?" And they go, "No, it's just I was almost hit by a car." But then they go, "But afterwards, as I was thinking about that, it got me down on my knees and I started to pray and I realized there must be a God." Um, and they end up having a profound spiritual awakening triggered by a close call. So they actually didn't have a near death experience by the criteria of a near death experience, but they had a brush with death that had a transforming impact on them. And sometimes it causes a bit of confusion because some people will call this, oh, a near death experience. So I'm just saying it's a non-NDE brush with death can also result in a spiritually transformative experience. We now know, and this has been alluded to by Brent Spirit, is that NDEs can cause a Kundalini awakening. And many researchers, Kenneth, Bruce Grace, and myself, we all have found in our research that NDEs can cause a Kundalini awakening. And what I'm going to add to that is that if you already have had a Kundalini awakening and then you have a near-death experience, that it seems to jumpstart you to a more advanced level on the Kundalini awakening. And I just want to mention here that my talk today is on NDEs, not on Kundalini, but that an awakening is a beginning. The Kundalini awakening is a beginning of a long-term transformation process. So even if you've had an awakening, there's still a long journey to go. It's just now you're on the accelerated path of your spiritual awakening once you've had a Kundalini awakening. So the NDE with Kundalini awakening puts you on an accelerated path in your spiritual awakening. And we now understand through the yogic model of consciousness that what's happening during a near-death experience is that at death, the soul, which is encased in its astral body and causal body, which is the energy body and the consciousness body, withdraws out of the physical body up the astral spine and leaves. And the Kundalini might awaken as the soul is withdrawing up the spine. And the soul then, encased in these two, the energy and light body, goes to astral heaven or other astral planes. And according to the yogic model, if a person does not have a memory of a near-death experience or out-of-body experience when they're near death, that they may have gone into what's called the great sleep. What we now realize, which is also new, actually new within the last 6 years, is that after a near-death experience, many people become multiple near-death experiencers, go on to have multiple near-death experiences over the course of their life. And this is particularly likely to be true if their first near-death experience happened when they were fairly young. And what's interesting too is that people who have multiple near-death experiences over the course of their life, like myself, and many others, is that they won't necessarily be all the same type of near-death experience. Some of them, their experiences might be out-of-body type of near-death experiences. Others of their near-death experiences might be the white light mystical realm, where they go into the heavenly white light and talk with spirits and archetypes. And some of them might also, even though they've had out of body, even though they've had mystical, they might have another one that's a distressing near-death experience. I mean, I spoke with one person who had all three types of near-death experiences. And he said that he felt each of them was transformative in a positive way. It was just the distressing one, it was a bit harder to get the lessons out of it, whereas the white light one was, in its very nature transformative. And the out of body one was confusing, but easier to integrate. So after near-death experiences, many become multiple NDE experiencers and can have many different types of near-death experiences. We also now know, this is new, that after a near-death experience, many, as an after effect, become multiple STE experiencers. So they're not just having more near-death experiences, they start having mystical experiences. They start having psychic experiences of various types. They start having inspired creativity. They might later on have a Kundalini awakening. So it seems the near-death experience makes them open to becoming a multiple STE experience, or many types of STEs, and often may go on to have repeated or ongoing STEs. So it just becomes a part of their everyday life. This is another new realization about near-death experiencers, is that near-death experiencers, the consciousness of near-death experiencers seems to be more open to trans-dimensional types of STEs. Now, Dr. Kenneth Ring wrote about this many years ago, but I also write about it in my books. So things that near-death experiencers seem to be more open to are things like encounters with angels, transdimensional UFO encounters, communications with beings that seem to be existing on other dimensions. We now know a lot more, too, about children's near-death experiences, and a lot of this is thanks to PMH Atwater, who's done great work on this area. And what we now know about children's near-death experiences is that they often don't even realize it was a near-death experience until they're an adult. And that certainly was true to me. It was only about 6 years ago that I put the label of near-death experience on my childhood experiences, because like other children, I just didn't label it as paranormal. It was just what was happening to me. And PMH Atwater has noted that childhood near-death experiencers may have fewer of the NDE features that Raymond Moody talks about. We now know more about children's NDE after effects, that they tend to see spirits. This was true of me, of my 11-year-old near-death experience. I saw ghosts for almost a year afterwards. Children with NDEs get curious about God. They may be more psychic, more intuitive, get premonitions. They tend to be gifted, highly creative, and of course, open to more NDEs and more STEs. We now also realize that there are physical after effects to NDEs that focus on increased sensitivities, that NDEers as after effects seem to be more sensitive to almost everything, more sensitive to chemicals, more sensitive to medications, sometimes resistant to medications, having to take a higher dose, but other times only needing a tiny fraction of a dose of the medication. Sensitivity to bright light, sensitivity to loud sounds, sensitivity to sense, sensitivity to others' energy fields. And often NDEers very frequently notice changes in their biorhythms, that, middle of the night awakening is really, really common. 3 a.m., join the crowd. I'm up at 3 a.m. Food aversions, food cravings, and also sometimes needing to eat more regularly, small meals more regularly. Sometimes people find they need more protein. Other times people feel they have an aversion to sugar. So various biorhythms changes can happen after an NDE, all normal. But I love this one. One of the physical NDE after effects that we now know about that's new is called electromagnetic sensitivity syndrome. And what this is that many NDEers, it seems like their energy field can disrupt electronic equipment. So I've been known to do this, and many other NDEers do this too. It seems that their energy field can disrupt computers, can disrupt microphones, can disrupt microwaves, can disrupt airport detectors, light bulbs. I used to pop light bulbs all the time. My energy has grounded more since then. Electronic locks. So this is the one aspect of electromagnetic sensitivity, is that the energy of the experiencer tends to disrupt electronic equipment. But there's the opposite side of it too, which is that many NDEers then find themselves sensitive to external electromagnetic fields. So when most people don't get a physical sensation from an electromagnetic field, that many NDEers, they can feel it and it's uncomfortable. I mean, they can't go under high power lines. You know, those, what are they called? 4D microwave, or not microwave, cell phone tires, that they're sensitive to those vibrations. So this is a very real phenomenon, an after effect with NDE experiencers. We now realize too that there's a spiritual after effect of a near-death experience, which is that people go into what's called the propelled heart stage. I talked about this last year. Their quest, they start on their quest, they start searching, they start looking for deeper understanding, they start reading all sorts of books. They might start with their own faith, they then go on to different paths, they start looking for others who've had similar experiences, they go on their spiritual quest. So entering this propelled heart stage is a very normal after effect, we now know, after the near-death experience. But there's also the psychological after effects, that there's like a purification effect. It's like the inner light has been shone and the shadow issues are now being exposed in our inner house, and people develop the inner urge to grow up. They suddenly want to deal with their issues. They want to do their shadow work. They go into psychotherapy. They embrace their addictions. They stop self-destructive habits like smoking, drinking, drugs, etc. But an additional thing happens, which I call purgation, which is that repressed memories will start spontaneously surfacing to consciousness in order to heal. It's like there's an inner wisdom in your psyche, and this might bring up present life memories as well as past life memories. We know every psychic ability is possible to be enhanced after an NDE. All the clairs, clairvoyance, clairsentience, clairaudience, premonitions, past life recall, mediumship, channeling. I won't spend time on this. But I want to mention we know about the inspired creativity NDE after effects, that many NDEers have markedly increased creativity afterwards. They might find themselves developing new creative abilities that they never had before. It could be now they start writing poetry or start doing art or start composing music or writing books when this was never something they did before. And this bottom one, downloads of understanding. This has become so commonly known. Everyone talks about the downloads, that this is an inspired creative NDE after effect that many, many people are having, we know about now. But I want to mention that there are also sometimes some very challenging NDE after effects that we know about. Difficulties with relationships because the person is changing, their values are changing, their focus is changing, maybe their political party is changing, and all of this can cause problems with relationships. They may feel very isolated, that they don't feel safe to talk to anybody about what's happening to them. They may have confusion and anxiety if they don't have a framework to understand what's happening to them. And they may have increased stress because they're recalling surfacing issues that they had not dealt with before. And I want to mention that we now realize that people after a near-death experience, they need more time for their spiritual practices. They find they want more time in prayer, in meditation, in journaling, going on retreats, and they develop a strong desire to live a more moral life according to the universal spiritual laws. And that with time, after time, people shift into another stage, which is called the steady heart stage, where the I am searching focus shifts to we are spiritually awakening. They become more humble, more respectful of others. Their love and compassion increases, and service to others becomes a priority. So you see this happening in many NDE experiencers with time, that service to others becomes a major priority. And as we're getting towards the end now, we now realize that the NDE spiritually awakening process is a long-term process. The NDE is just the first step. It's a lifelong process, and there are many levels of growth and deepening that we go through. So when you ask me, what have I learned through my 5 near-death experiences and 40 years of NDE and STE research? Well, what I have learned is that God, our higher power, absolutely exists. Whether we believe it or not doesn't matter, absolutely exists. And the nature of that higher power is love, profound, unconditional love. And that we are all immortal souls that live on after we die. We live on in another dimension and then reincarnate to continue our soul's learning. And that meditation and right living are the keys. And right living, I mean by body, mind, and spirit right living. And combined with meditation is the best, safest, and fastest way to expand our consciousness, to grow spiritually, and find our way home. So in conclusion, I'd like to end with what I've realized is that the purpose of life, as Paramahansa Yogananda said, is to find God. And where we're going to find God is in the temple of our own hearts and our purified consciousness. So with that, I will stop screen sharing, and I'd be very happy to answer your questions.
Yvonne, that was just a tremendous presentation. Thank you. I have a question for you. It's a personal one. In all your years of expertise and exposure to those who have experienced NDEs, is there one type of an NDE that you feel is more common, a more common type than others? And in contrast, which type of NDE is the least common? Is that possible to answer that?
Well, I can't give you the statistics on what is more common or what is less common, Robert. You'd have to go to one of the statisticians on that. But what I will say is what is more transformative, now that I'm very aware of, is that the mystical type of near-death experience, so ones where people went into the white light, may or may not have had a light for you, any encounter with the higher power, that these can be absolutely life-changing, like from black to white. That is the mystical near-death experience, which is a type of mystical experience, because mystical experiences are the most transformative of any type of STE. Those are the most transformative type of near-death experience.
Thank you. Tim has a question for you. Dr. Yvonne, you mentioned remembering your past lives and your experience. Did that memory stay with you or did it fade away? That's one part of this. Did seeing those lives give a sense of soul evolution or purpose to our life journey? And he also said, thank you for your presentation, your inspiring talk.
Thank you for that question, Tim. I have to answer it yes and no. I know that's a confusing answer. But when I was on the other side during my most recent near-death experience, which was in November of 2003, and I described how my consciousness capacity expanded. So it was as if my normal brain, you know, and I am considered gifted, but let's just say that my brain is like a Pentium 4 computer in terms of its capacity and processing speed, just as an allegory. It felt like my consciousness capacity expanded while I was on the other side to a Pentium 1000. So I had a vastly expanded capacity to absorb, assimilate, understand, process, integrate all at the same time. So it was like this massive aha experience. Like think of it as a mega, mega, mega download, like just all at once. And in that expansive state of consciousness where I could remember all my past lives, yes, it seemed perfect. It all made sense. It all made sense in terms of evolution of my soul, my soul journey. I saw myself incarnated, man, woman, old, young, different cultures, different colors, different religions, not always on this planet. And but it all made sense. The whole picture made complete sense that it was all this incredibly beautiful plan. And I understood when I looked at it who I was, who I am. And it was this wonderful healing experience. Like, this is who I am. Now I remember who I am. And any one of those incarnations is not who I am. It's like an actor or actress who plays many roles in many different movies. Who the actor is not any one of those roles, right? The actor transcends all of those roles. So it was profoundly healing. And whether or not I had the capacity to remember them here, because my brain is no longer a Pentium 1000, no, I cannot remember all of them at the same time. But what happens here, the way it's been explained to me by spirit, it's on a need to know basis. Sort of like having massive files in your computer. You can't have all the files open at once because your screen will just jam. But on a need to know basis, when I need that particular file, then it comes into my consciousness and goes, oh yeah, that's what's happening here, that we're reenacting this, or I'm drawing on skills that I had in that incarnation. So on a need to know basis, it's like the files will come out of my memory drive. I hope that answers your question.
Thank you. Here's another question from Kimberly. Does the ego subside for them? And I think she's talking about NDEs for them, and make them hyper aware of using evil eye or the light of the creator.
Okay, I don't know what she's saying about evil eye, but
Evil eye.
yeah,
Or
I don't know anything about evil eye. But what I can say is this about the ego and what happens with the ego is that my understanding about the ego has really grown and evolved over the years. And I come to understand that the ego has a very important role in our consciousness, which is to operationalize what spirit is guiding us to do. So, if we were all in samadhi and didn't have an ego, how would we, drive the car, do the grocery shopping, pay the bills? We need the lower mind or the ego mind to do these tasks to operationalize in the world. The problem, as I see it, as I've come to understand it through my many experiences and on the other side, is the problem is when people think the ego is supposed to be in the driver's seat. The ego is not supposed to be in the driver's seat. The spirit, our higher self, should be in the driver's seat, telling the ego what to do. And as we grow spiritually, we learn to find the correct function, the correct place for the ego in our psyche. And some people say it's about destroying the ego. It's not about destroying the ego. It's about finding the right place for the ego. And actually that's very, very healing because the ego's a part of you. It says, I don't want to be killed, but actually it's very comfortable not being the driver. that the ego's very comfortable once it finds its correct role, which is to operationalize what spirit guides it to do. And then the ego's feeling, yeah, I'm doing the right thing. This is where I fit, and I have found my place.
Thank you. Next question is from someone named Sunny. Dr. Yvonne Kason, did you get insight or knowledge from your 5 NDEs about what our loved ones who have passed on are doing back home while we are still back on Earth?
Thank you for that question, Sunny. In my particular NDEs, I was not shown about my loved ones. Now, there are other people who, during their NDEs, are shown things about their loved ones or actually encounter departed loved ones. So, not everyone's NDEs are the same. And so I'm just saying, in my specific near-death experiences, on none of them did I encounter my departed relatives.
Thank you. Next question is from Stephen. Dr. Kason, this is a time of profound spiritual transformation. Do you consider it akin to a Kundalini awakening?
All right, so there's a couple levels to that question. I think this is the time of great awakening happening on the planet. And a couple of our speakers today had mentioned to this that according to yoga, we're in Dwapara Yuga, which is the time of spiritual awakening. So more and more people will be having spiritual awakenings on the planet. I'm convinced that is true. And I'm even witnessing this in my lifetime, that more and more people are having near-death experiences, Kundalini awakenings, spiritual awakenings of all kinds. Now, are they all Kundalini awakenings? I don't think they are all Kundalini awakenings, but I think they're all related to spiritual awakening, and that we can have spiritual awakening happening at different speeds. Shall we look at it as school, if you're in the regular classes or if you're in the accelerated classes, right? That I think all of the planet, everyone on the planet as souls, we're evolving on some sort of speed. Everybody's developing spiritually, and let's call that the regular curriculum in the school of life after life after life. But when you have something like a near-death experience, it might bop you from grade 2 to grade 4 because suddenly you've just absorbed a whole bunch of information in a few seconds in your near-death experience, so you skipped a few grades. Now, if you activate the Kundalini using the same analogy, it's like you're in the accelerated curriculum. Like it or not, Spirit thinks you have the capacity, so you start moving through the grades faster and faster and faster, and the spiritual lessons and the purification are it's necessary to do it faster. And so that's how I view it. That the whole planet is at we are in the Great Awakening right now, and different people are awakening at different speeds and in different ways.
Thank you. I think this will be our last question. And there are plenty here if you want to go through them. If you save the comments. But this is from Ken. Yvonne, what are your thoughts about NDEers whose egos get larger after their NDE? They appear on every podcast and claim to have clear answers to life. They sometimes judge the spiritual paths of others.
Oh dear. Thank you for that question to Ken. As I mentioned that there are many stages in the spiritual awakening process, and that one of the clear signs of progress on the spiritual awakening path is humility, increasing humility, and compassion, and putting others before oneself, wanting to be of service to others. So those are clear signs of progress on the spiritual path. And one of the reasons that I showed that picture near the end of, the baby, the child, the older adult, and said it's a long-term transformation process after a near-death experience or spiritual awakening of any kind, is that unfortunately that's a common mistake. Um, I'll call it a newbie mistake or a beginner's mistake, that somebody thinks they've had one glimpse, therefore they have all the answers. And the truth is, the more glimpses we have, the more we realize we don't have all the answers, that the cosmic plan is so vast and complex and infinitely beautiful that we only know that which we've been shown. But there are vast, vast, vast portions that we haven't been shown yet. And the more glimpses we get, it's sort of like the smaller we realize we are. It's like a paradox because one, we realize we're part of this great whole. So, I finally feel like, I know who I am. I'm this little soul that fits in this manner in the complex plan. But I'm also at the same time aware that I'm just a little fleck of sand on the beach of, the ocean of the cosmos. And the more glimpses one has, the more humble they become.
That'll do it for this presentation. I want to thank you. You did an excellent, outstanding job. And I always learn something whenever I talk to you, even after all these years.